ever had severe abdominal pain, cramping, bloating, misery, and it wasn't that time of month? Had you eaten all of your fiber, drinking all 2 liters of fluid that the doctor recommends? Well, chances are you didn't have diverticulitis. But if you did, it would look a little bit like this.
Hi, good morning. So today we are talking about the diverticular disease. So diverticular disease is where you have the outpouchings of the colonic mucosa and underlying connective tissues through the colon wall. Diverticular disease require outpouchings, which makes them false diverticular. So we will compare the true and false diverticular later. So let's begin by recapping some anatomy of the colon here. So here is our colons and our stomach here, and here's the small intestine. The beginning of the colon is the sacrum. So here is the ascending colon, here's the transverse colons, and comes to descending colon, and this area is the sigmoid and goes to the rectum. So it's important to note that the sigmoid, this part, is where most diverticular occurs in the Western country. But however, in Asian populations, most people have the diverticular disease on the ascending area and transverse area. Before I continue, it's important to know some terminology about the diverticular disease. The first one is diverticulum. It's only for one outpouching. And the second one is diverticular. It's multiple outpouching of the colon. And next one is diverticulosis. It's the diverticular with no symptom. And when it comes to the diverticular disease, it's an umbrella term which can present as either symptomatic or asymptomatic diverticular. I prepared 2 slides of the diverticular, what it looks like on our colon. So this is the normal one. We can see the outside layer is very smooth, and we can see the blood vessel here. Here is the lumen. So this is the normal one. And when people have the diverticulosis, we can see the outpouchings through the colon wall. And it have 2 types of it. One is a true diverticulum. It means like all layer is outpouching. But the fourth one, it only has the mucosa layers outpouching, but the muscle still connected. So this is the 2 types of the diverticulosis. And when we talk about the signs and symptoms, most diverticulosis disease, they don't have the symptoms. Many people with the diverticular, they don't have any signs like the pains or diarrhea. But when it goes to the diverticulitis, it means when we have the inflammations in our colon, the signs start show up like diarrhea or the abdominal pains like that.
Now, diverticular disease usually only impacts the colon. But as these outpouchings grow and become more inflamed, leading to diverticulitis, some serious complications can occur. So think about a balloon. As you fill a balloon up, the balloon gets bigger, the rubber gets thinner, and it can cause little leaks and tears and incisions in these balloons in the colon. These leak out bowel contents into the surrounding area, and eventually these little balloons can just pop. And just like that, stuff hits the fan. Well, not literally. It runs into the sac surrounding our abdominal organs called the peritoneal cavity. and it becomes red, irritated, inflamed, and just like my mom when she's angry, it's deadly when left untreated. This potentially fatal condition requires surgery to remove all of the yucky bowel contents that just spewed into your abdominal cavity. These little pouches of misery can also cause obstruction of the bowel, and they can interfere with, well, the delivery of certain packages. This also has to be surgically corrected. On top of this, 30% of patients suffering from diverticular disease can experience abscesses inside their colon. These pus-filled pockets have to be corrected with surgery as well, including antibiotics. Another way that diverticular disease can impact other organs in your body other than the colon is what's called a fistula. A fistula is the joining of two organs through a route that shouldn't be there. So, although it's normal in dialysis, you do not want a fistula forming inside your colon. It can happen between the colon and the small intestine, it happens between the colon and the bladder, or even through the vagina. And in 14% of patients, it needs to be resolved surgically. Which of the following inflammatory conditions is most likely to result from diverticulitis? Is it A, pleuritis, B, peritonitis, C, pancreatitis, or D, plantar fasciitis?
Predominantly, the most relevant segment of the head to toe is the abdominal assessment in this case. Remember that this is the one where the assessment is performed in a different order than really any other body system. When inspecting the client, aside from seeing that they're visibly in a lot of pain, perform the PQRSTU. If I were the gambling type, I would put money on identifying precisely where and how bad the client's pain is. In diverticulitis, the left lower quadrant is king. Odds are the pain will be focused in the upper abdomen and left side. It can also radiate down to their lower back and pelvis. In this case, a great way to remember this would be the word pouch. P is for pain, the lower left quadrant. O is for observed bloating. U, unrelenting cramps. C, constipation. H, high temperature. You want to observe abdominal distension amid their waves of unrelenting cramps that have been said to be on par or possibly worse than labor pains. Ask the client when their last bowel movement was and whether there was any blood in it. More than 3 per day, usually accompanied by nausea and vomiting, is a good indicator. And we all know that itis indicates, you guessed it, fever. When next auscultating the abdomen, check for normal bowel sounds. Obviously, if not present, you'll want to listen for a full 5 minutes. It could mean that they're constipated, or it could mean that they have an obstruction. Palpation, if you can actually manage to do this without making the client scream too much, should reveal tenderness, swelling, redness, warmth, and possibly a mass or lump. Please monitor your client for peritonitis. It is one of the most severe side effects that can occur from diverticulitis. When a diverticulum gets infected, it can abscess. If this abscess were to rupture, the naturally occurring bacteria, along with that infection, will spill into the abdominal cavity. Peritonitis can cause fever, hard and distended abdomen, painful bloating, and, oh yeah, death. So it's kind of important to check for this among your clients, especially those with diverticulitis. Now, true or false? Most patients with chronic diverticulitis require surgery at some point, such as a bowel resection. If the healthy bowel cannot be reconnected right away, a permanent colostomy will be created until it can be reconnected. The answer is false. Most patients with chronic diverticulitis do require surgery at some point, such as a bowel resection. But if the healthy bowel cannot be connected right away, a temporary, not permanent colostomy can be created until it can be reconnected. Thank you to Hank Green and all the Patreon patrons who helped make this real crash course videos possible. A big thank you to Dr. Janice Paulette for sponsoring this episode of Crash Course Pathophysiology. This episode was filmed on location at the Concordia University Barnes campus studio. It was written collaboratively by Jessica Altman-Pollock, Kristen DeHoyo, and Kian Lee. Edited by Katrina DeHoyo and animated by Jessica Altman-Pollock with the help of Animaker.com.